Welcome to my channel. Your periods are regular and you have undergone various hormone tests on the doctor's advice and all reports are normal. Your husband's semen analysis test also normal. Despite both of you having regular intercourse but pregnancy is not happening. In this case, it is essential to find out whether you have fallopian tube blockage or not. Research suggests that in about 30% of cases, fallopian tube blockage causes infertility. If there is a fallopian tube blockage, pregnancy won't occur. So, in this video, I will discuss about what are the symptoms of fallopian tube blockage, the causes and treatment of fallopian tube blockage. Is it possible to treat fallopian tube blockage at home and increase the chance of conception? So, let's get started. Before that, we should know about what is fallopian tube, what is the importance of fallopian tube for conception. The fallopian tube is a part of the female reproductive system that connects to the ovaries to the uterus and play an important role in the reproductive process. Look at the picture. The name of this part is fallopian tube. Now discuss about what is the importance of fallopian tube for conception. In the female reproductive system, there are two ovary and fallopian tubes, one on each side, and the fallopian tubes are connected to the ovary. In these ovaries, eggs are usually stored. Every month at a specific time in the female body, an egg is released from the ovary, which is called ovulation. After being released from the ovary, the egg waits in the fallopian tube for the male's sperm. During this time, when one has intercourse, there is a fusion of male sperm and female eggs in the fallopian tube, resulting in fertilization and pregnancy. After fertilization, the embryo spent about 5 to 7 days traveling through the fallopian tube towards the uterus. During this journey, the embryo undergoes cell division and receives essential nutrients for the tube's lining. After reaching the uterus, the embryo implants itself into the uterus lining, a process known as implantation. If everything goes well, the pregnancy rings. However, if there is a blockage in one or both fallopian tubes, the eggs and sperm may not meet, preventing fertilization. As a result, conception is not possible, leading to difficulty getting pregnant. That's why the fallopian tubes are so crucial for conception. Now the question is, why does the fallopian tube block? Number 1. Infection of the uterus. If there is an infection in the uterus, it can lead to fallopian tube blockage. For example, PID or pelvic inflammatory disease, STD by sexual transmitted disease, and endometriosis. As a result of such an infection, abnormal discharge may occur. These abnormal white discharge in women can create a kind of barrier, leading to fallopian tube blockage. Therefore, if you notice yellow, foul-smelling or milky discharge, it is advisable to consult a gynecologist. Number 2. If there is a tumor on the uterus, it can also cause tube blockage. Number 3. Previous abdominal surgery can also lead to tube blockage. Number 4. If there was a previous ectopic pregnancy, it can also result in fallopian tube blockage. Now, what are the symptoms of fallopian tube blockage? There are no specific symptoms to understand the fallopian tube blockage. Number 1. Difficulty in conceiving. If someone has regular intercourse but is unable to conceive, it might be an indication of possible fallopian tube blockage. 2. Lower abdominal pain. In some cases, there may be mild to moderate pain in the lower abdomen. Number 3. Abnormal discharge. Unusual or abnormal vaginal discharge might occur in some cases. However, abdominal pain and vaginal discharge alone do not confirm fallopian tube blockage. The main symptom of fallopian tube blockage is difficulty conceiving. How to diagnose fallopian tube blockage? To diagnose fallopian tube blockage, doctor may use the following test. Number 1. HSG or hysterosalpingography. It is a type of X-ray performed to detect fallopian tube blockage. In this test, a liquid called dye is inserted into the uterus of the woman and then X-ray is taken. If there is a blockage in the fallopian tubes, it can be identified. Look at the picture. In the first image, dye solution can be seen on the both sides of the fallopian tubes that indicate no blockage. However, in the subsequent image, observe that one side the dye solution is visible in the tube, but there is no dye solution seen in the other side. This suggests the presence of blockage in the one of the tube. Number 2. Sonohysterography or saline sonogram. This is a test where saline solution is injected into the uterus to perform a sonogram and detect any blockage. Number 3. If both the HSG or hysterosalpingography and sonohysterography tests do not provide a clear diagnosis of blockage, doctors may perform laparoscopic surgery to diagnose the blockage. Now discuss how to treat fallopian tube blockage. If a fallopian tube blockage is confirmed, the treatment would aim to open the blockage. However, even if one tube is blocked, natural conception can still be possible as ovulation alternates between the ovaries each month. For example, if ovulation occurs from the right ovary in January, it might be happen from the left ovary in February, allowing the possibility of natural conception. If there is a blockage on the both sides and the blockage is minimal, tubal recanalization is performed. Through this method, an attempt is made to open the fallopian tube blockage by inserting a tube into the uterus, similar to cleaning a blockage in a pipe using water pressure. If the tubal recanalization is successful, the chance of conception increases. However, tubal recanalization does not always work. In such case, laparoscopy is performed. Laparoscopy is used when the blockage is severe or resistant. It allows the removal of the blockage or resolves issues like tumors or endometriosis causing the blockage. In such situation, the chance of conception also increase. But sometimes, even after trying all these methods, it not be possible to open the fallopian tube blockage and conception. In such scenario, there is only method left for conception, either IVF or test tube baby. In this process, the sperm and eggs are fertilized outside the fallopian tube. After fertilization, the embryo is placed into the uterus where it implants, leading to pregnancy. Now discuss our final question. Is it possible to open fallopian tube blockage at home? The chance of conceiving depends on the severity and location of the blockage. There are no specific medicine, food, exercise or massages that can open your blocked fallopian tube. Many people say that consuming vitamin C, ginger water, turmeric milk and garlic etc. can remove the blockage. Actually, this is not entirely true. These remedies contain a significant amount of antioxidant that helps reduce inflammation in our bodies due to infection. Fallopian tube blockage mainly occurs due to the infection, and some of these remedies can help you get relief from the infection. However, if the tube is blocked, there is no way these foods can remove the blockage. Do not be misled by watching video on YouTube. For staying healthy, eat nutrient food. But if you have a tube blockage, please consult a gynecologist. Hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.